Thank you for joining us for this special webinar series highlighting the new 2014 research grants funded by the AKC Canine Health Foundation. In all, 17 grants were approved, totaling nearly $1.5 million for canine health research. These projects cover 10 unique areas of canine health. In each of the short videos in this series, CHF's Chief Scientific Officer, Dr. Shila Nordone, explains the proposed work, significance, and impact for each grant, and how these projects will work together to move canine health forward so that all dogs can live longer, healthier lives. We hope you find these webinars to be informative and exciting. Please visit www.akcchf.org/donate to show your support for our funded research. In this session, Shila will be discussing our new grants within the Musculoskeletal Conditions and Disease Research Program area.
Musculoskeletal health has always been a concern for many of our donors, and so we've really tried to develop a robust musculoskeletal research program area that we're also hoping will work in conjunction with our Canine Athlete Initiative. As we know, more and more dogs, over 1 million dogs last year, participated in sporting events, and with increased participation we have new health concerns that we need to address in the dog. So our musculoskeletal health program, as well as our Canine Athlete Initiative, will hopefully work together to solve many of the concerns that we have right now in musculoskeletal health. The first grant that we funded in our Musculoskeletal Conditions Research Program area is Grant 1828, Mapping of Genetic Risk Factors for Canine Hip Dysplasia. The principal investigator is Dr. Antti Ivaninen, and our co-investigator on this grant is Dr. Hans Lohi. And they're at the University of Helsinki and the Folkhälsan Institute of Genetics, and the total grant amount is $94,781. So hip dysplasia is a very common problem in the dog, and we believe this complex disease is under the influence of genetics, environment, and diet. It progresses from a looseness of the hip joint to a secondary painful osteoarthritis. And the goal of most breeders is to enhance their breeding program by using genomic selection to breed away from hip dysplasia. The goal ultimately is to develop genotypic breeding values, or GBVs, that will use established genetic marker data for hip dysplasia to enable breeders to breed away from this painful disease in dogs. And the belief is that through using genotypic breeding values, or GBVs, we will have enhanced accuracy in our breeding programs to select away from hip dysplasia. So how do we get there? How do we ultimately improve our breeding programs so we can breed away from hip dysplasia? Well, genotypic breeding values will ultimately be established by determining the individual genetic markers and also something called quantitative trait loci that are associated with disease. And the belief is that combined with information about pedigree relationships between affected and unaffected dogs, we'll be able to create GBVs that will enable us to make these breeding decisions. And for those of you who are not familiar with QTLs, or quantitative trait loci, these are not individual markers, but rather stretches of DNA that contain or are linked to genes that underlie a quantitative trait such as hip dysplasia. So the goal of the hip dysplasia grant is to perform a GWAS study, a genome-wide association study, using gene chips that will measure 173,000 variable regions of the dog chromosomes. The researchers will use the German Shepherd dog as the breed in this study, and they will use more than 400 dogs to be genotyped that are either affected with hip dysplasia or normal controls. The GWAS will compare the two groups and find any genetic markers that uniformly segregate with either the healthy group or the affected group. Deliverables of the hip dysplasia grant are that once significant genetic markers are identified in this cohort of German Shepherd dogs, the researchers will be able to compare their results to other cohorts of German Shepherd dogs, as well as move across breeds. For verified genetic risk markers, the researchers will attempt to identify causative genes and those quantitative trait loci for genetic risk of hip dysplasia. And ultimately, once a panel of genetic markers is validated, they can create those genetic or genotypic breeding values that breeders can use then as tools to make breeding decisions within their breed. So as I said earlier on, our hope is that our musculoskeletal research program area will work in conjunction with our Canine Athlete Initiative. And so now I'm going to tell you about two grants that cross over into our Canine Athlete Initiative. The first grant is 2078, Development of a Regenerative Medicine Technique to Treat Cartilage Disorders in the Dog. The principal investigator is Dr. Brian Saunders. He's at Texas A&M, and the total grant amount is $120,872. The focus of Dr. Saunders' grant is osteochondrosis, which is a common and debilitating disease that affects large athletic dogs. It's caused by abnormal endochondral ossification, and this is the process by which growth plate cartilage adjacent to joint surfaces transitions from cartilage to bone. In these dogs with OC, we see excessively thickened cartilage that partially or completely separates from surrounding bone. The cartilage separation then exposes the joint to underlying bone and creates a very large loose body termed a joint mouse within the joint. And unfortunately, we've made very little progress in the treatment options for osteochondrosis for over the last few decades. So the deliverables of Grant 2078 are focused on tissue engineering, generation of regenerative osteochondral plugs, or ROPs. ROP layers are bioactive, directing encapsulated stem cells to differentiate into specific tissues to more efficiently restore normal joint anatomy. And what Dr. Saunders is going to do is optimize the material that we can use to generate these ROP layers. He's going to determine if stem cells from the tissue lining the joint or synovium or inner cavity of the bone marrow, more efficiently reconstruct native cartilage and transitional tissue or bone. And ultimately, this will result in a novel, effective treatment for painful, debilitating osteochondrosis. And we hope that we'll also see application of this research to osteoarthritis, which affects around 40% of dogs. The next grant that was funded in our Musculoskeletal and Canine Athlete Initiative is Grant 1985, Defining Novel Drug Targets to Treat Chronic and Neuropathic Pain in the Dog. Pain is an emerging problem that we're just now starting to understand. As I said a minute ago, 40% of dogs are symptomatic and have associated pain with osteoarthritis. And so pain is an area that we are absolutely trying to fund more research in. Grant 1985 is, the principal investigator of Grant 1985 is Dr. Ronald Sloiter, and he is at the University of Wollongong, and the total grant amount is $94,128. So before we start talking about the grant, I want to give you a little background into chronic and neuropathic pain. Chronic pain is pain that lasts longer than 3 to 6 months. Neuropathic pain is pain that's caused by damage or disease that affects the sensory and nervous system. And pain is associated with multiple diseases and injuries and profoundly affects a dog's quality of life. So this new OAK grant is actually a competitive renewal of Grant 1265, Understanding Mechanisms Involved in Canine Autoimmune and Inflammatory Disorders. In that grant, Dr. Sloiter discovered the canine P2X receptor. The P2X receptor is ubiquitously expressed across tissues and has a very broad-based function. It's been implicated in chronic, neuropathic, and inflammatory pain, dry eye disease, irritable bowel syndrome, interstitial cystitis, dysfunctional urinary bladder, and cancer in humans. So it's a receptor that's expressed across a broad range of tissues and clearly is associated with a variety of diseases. So the focus of this new grant and the deliverable of this new grant is to define the role of the P2X receptor in pain in the dog, with the goal being to create or identify a new therapeutic target to treat pain in dogs. And finally, I wanted to remind you about the very robust funding program we have for cranial cruciate ligament disease. Last year, we funded several grants that will address cranial cruciate ligament disease in a variety of ways. 1762, the development of a technique that will use platelet-rich plasma to treat disease. 1782, a computer modeling of surgery and confirmation grant by Gina Bertacci that will help us understand the best way to surgically intervene in cranial cruciate ligament disease. 1865, using stem cells as a source for treatment of cranial cruciate ligament disease. And finally, 1584, creation of a conformational score that will help us breed away from cranial cruciate ligament disease. Again, all of these grants working together to deepen our understanding of the cause and treatment of CCL disease in the dog. And I also wanted to remind you that today's Breeder Magazine did a beautiful story in issue 82 called Stabilizing the Stabilizer that really does a beautiful job of outlining our full cranial cruciate ligament disease program.
For more information and to support these grants, please visit us online at www.akcchf.org/2014 grants.